Neil Patterson here. The Sky News Daily will be on the way in just a moment. First, though, I do have a bit of a favour to ask. Please do give the podcast a follow. You might have noticed the news is moving so quickly these days it can be hard to keep up. By following the Daily, you make sure every weekday you get an episode downloaded to your devices that tells you all you need to know, and a lot more besides, about one story in the news. So, if you like what you hear, do give us a follow on your podcast app or audio streaming service. Coming up today, worrying about the health service is nothing new. But now we have something called health anxiety. What is it? And why is it putting even more stress on the NHS?
Donald Trump is heading back to the White House.
Together we can truly make America great again.
We are in for an unpredictable but fascinating 4 years.
And we're going to be following every twist and turn for the first 100 days. We'll be bringing you the latest updates and analysis first thing every morning. So join me, James Matthews.
Me, Martha Kellner.
And me, Mark Stone.
For Trump 100, every weekday at 6 a.m, wherever you get your podcasts.
Hi everyone, big day for NHS England. We've got fresh data out on waiting times, waiting lists, and all those metrics that have come to be routinely associated with the health of the health service. We of course know this government aims to turn the NHS around, but even the Health Secretary admits it's broken, it's at capacity or even beyond it. And now you can add to the mix of reasons for NHS overstretch health anxiety, literal fears about your physical well-being, which often results in unnecessary trips to hospital. Ashish Joshi is our health correspondent. He has been at the Royal Berkshire Hospital in Reading today. In fact, he's been heading there very regularly for quite some time. Ashish, just tell me a little bit about the place.
Royal Berkshire Hospital in Reading is the main acute centre for the trust there. It's right in the middle of the town centre. It's an average performing hospital. Some would argue, especially its clinicians, that it performs better than most of the hospitals in the southeast of England. In fact, it does have one of the busiest accident and emergency centres in the southeast of England, and it still manages to perform quite well. But that's all relative. When you say quite well, 4 hours waiting time, 2 hours for an ambulance, it's almost normalised now, and it wouldn't have been pre-pandemic.
So you talk of the winter crisis. Winter crisis immediately puts me in mind of colds, flu, norovirus, the like, respiratory infections. But
Yes.
the problems within the Royal Berkshire on that day, I suspect, were not simply limited to respiratory.
If you speak to the clinicians, and this is what really, actually I was surprised to hear. I have private conversations with doctors and consultants all the time, and they will tell you things off record which they won't say on record. They never talk about patients who present who shouldn't be there. It's a given that they think a percentage of their patients would be better served elsewhere in the National Health Service. What I found quite striking on these multiple visits to Reading in particular, I spoke to the same consultants, Dr Omar Nafusi, who's one of the leads in the A&E department, or emergency department as it's now known. He was really candid, Neil.
There's a lot of anxiety after COVID, and we've seen that. Young people with chest pain, which they've had for a few minutes, are concerned they had an heart attack. There's a lot of little things that before would have been nothing, but now is something.
He was just saying, look at my waiting room. It's full. It's brim full of people. 60, 70, 80% of those people might not need to be there. He said, but they come because the ED doors are always open. They turn up here. Some need to see a specialist. Some have just delayed seeing any doctor for weeks and months, and their condition has become worse. He said, but we are an emergency department. He said, I want to save lives. If you've been in a car accident, you've had a stroke, you're having a heart attack, there's something else going on with you and your life is in danger, come and see me, come and see my team. We're the specialists. Get in, be treated, we'll save your life, and you can get out. But those people who are there, he was saying, don't need to be there, and they're clogging up the system.
Ashish, it's rare for me to admit a gap in my knowledge, but health anxiety has been talked about as perhaps being a contributing factor, particularly amongst 20 to 40-year-olds, in pushing greater numbers through emergency units and the health service in general. First things first, what on earth is health anxiety?
A health anxiety is anything that keeps you up at night worrying about your health. And what it could be anything. It could be something really minor. You put your finger at the back of your neck. Oh, there's a bit of a lump there. Oh no, that lump must be cancer. I must be dying. Ergo, I need to see my GP right now. And if I can't see my GP because it's that 8 a.m. morning rush, I will go to ED and I will be seen by someone like Omar Nafusi or one of his colleagues. I'll wait for 6 hours and they'll take a scan and they'll tell me I've got nothing to worry about. That's a health anxiety. I was quite surprised how often this came up during filming. So we went to a GP. Dr. Amit Shah runs 4 GPs that serve that catchment area for the Royal Berkshire. And the first thing he said to me is, my waiting room is full of people with health anxieties. These are younger people, 20, 30, 40 perhaps, who have come through the pandemic. Everyone is suddenly acutely aware of their health. And they want to see someone to make sure that they're not dying or are not becoming even sicker, right? So these are people who are on their smartphones, lump on neck, cancer. Right, I need to see my doctor. And I put it to him. I said, hang on, you're dismissing this cohort of patients who you say years ago would have just dismissed it, taken some paracetamol and got on with it.
So what do we think is behind this jump, this big jump, in fact, in health anxiety?
We all care about our health even more now because we've all experienced a pandemic, right? People have lost loved ones and their own health has suffered. But for somebody else who might have been relatively healthy at the beginning, caught COVID, lived through it and came out the other side, they are now in tune with their health. These are people now who have suddenly developed an anxiety about health and they want to see their GPs. But you speak to Amit Shah, he'll tell you, I don't need to see these people. They don't need to be seen by anyone. But because I can't turn them away, they're the numbers. They're swelling the register. Millions of extra appointments being created just for people like these. I think the fallout from the pandemic is still being felt and will be felt for generations to come.
What on earth can be done? I mean, I'm sitting here scratching my head, apart from, wagging your finger at someone or indeed turning them away.
Well, I'm glad you said that because another one of Dr. Nafusi's colleagues, that was another big moment for me. So I said, look, your ED's busy. It's always busy. What are you going to do? She said, we're going to stop seeing people. I said, what? You can't be serious. You can't turn people away from ED. She said, why not? If you have a patient turning up, presenting their triage, you don't need to see an ED doctor. Here's where you need to go, community hospital, community setting, or go home and somebody will call you. That is a radical shift, right? And how palatable is it for people who want an on-demand 24/7 health service? That is, I think, how we are going to be able to deal with what you were just talking about, health anxiety.
And we'll be back to Ashish a little later. But given it's the place we head when things go really badly wrong, the pressures on NHS England accident and emergency units are very troubling. So let's try and get a somewhat broader view. Dr Adrian Boyle is president of the Royal College of Emergency Medicine. Adrian, just why are we seeing so many problems in our emergency departments?
So let's define the problem. The problem is that we've got people who pretty much have nowhere else to go to. They come to an emergency department, they're sick and they need admitting, and there's this long delay before they can be admitted into a ward bed. This is particularly bad for older people. These are the people who are particularly disadvantaged by it. And these people are really getting very long stays in undignified circumstances, and it's causing a lot of harm.
You say nowhere else for them to go to. My immediate thought would be, well, there are 2 options, surely. They can dial 111 any time of day or night, or they could go and see their general practitioner. Absolutely,
and those things are useful for the population at large. What we're talking about here are actually patients who are sick, who need admitting. And these are the ones who get stuck in emergency departments because our hospitals are so full. Today's figures show that the NHS acute hospitals are running at about 95% occupancy. Hospitals work much better and they're much more efficient, and they can look after people properly in the right places when they've got low occupancy. And we say that should be about 85%.
Is this not just a natural consequence of the fact we are in the winter season?
No, the winter viruses are very much a straw that's breaking the camel's back. we've actually got the number of patients going into our emergency departments is pretty much the same each month. What's happening is, and we're seeing the same sort of crowding that are going on in the summer. Now, the media give us a lot of interest over winter. You know, the first 2 weeks of January and every third Thursday of a month is like a regular fixture list for the media. But these problems are year-round problems.
When you say year-round problems, we've always been led to believe that there is this cycle, that there's this terrible time of pressure over the winter months, and then there is a moment of respite or months of respite in the summer. Are we just not seeing that winter-summer cycle anymore?
You talk to my colleague, any emergency medicine consultant, and I'll talk to you about the phenomenon of Narnian winter. It's always winter and never Christmas. So these are year-round problems. There will be people spending far too long in emergency departments in August. I can guarantee it.
We've been speaking to our health correspondent, Ashish Joshi. He's been down at the Royal Berkshire in Reading over the past couple of months. And a phenomenon that he has been mentioning, and indeed the healthcare professionals that he's been alongside have been mentioning, is health anxiety. To what extent do accident and emergency units bear the brunt of this phenomenon?
So there are absolutely a number of people who turn up to emergency departments because of health anxiety. But I also see a lot of patients who have tried to do all the right things, like go and see their GP or phone NHS 111, and they are advised to go and seek help, and they'll go to help where help is available. So yes, there is a bit of health anxiety, and the internet sometimes isn't our friend on this. But I would also turn this around. We've also got problems with lack of confidence in the system, and what we're seeing increasingly is that people are so scared of going to emergency departments, particularly if they're elderly and they know that they'd like to be admitted. They're very worried about the long waits, and they're losing confidence in the system. And people then aren't going to an emergency department when they should.
Can we trace all this back just to provision of beds?
Yes. So the UK has the least number of beds per head of population of almost any European country. The only country which has less beds than us is Sweden. But Sweden actually uses its beds very carefully and has very good social care. We are in a perfect storm because not only do we have not very many beds, we don't use them very well and use them very efficiently. Amanda Pritchard, CEO of the NHS England, was talking this morning about 1 in 7 beds are occupied in our hospitals with people who are waiting for a social care intervention. So not only do we not have enough beds, we're not able to use them as efficiently as we should.
Dr Boyle, how fair would it be to say that when it comes to the state of emergency medicine in NHS England, it has been for some time now in a period of managed decline?
I think that's a fair comment. I think there are some reasons to be hopeful around this. I qualified in the 1990s. At that time, there weren't very many emergency medicine doctors. We didn't have much of a training program. Now, when I look at the way we train our doctors and the number of doctors we have, and certainly the skills that we're giving our nursing staff, that's much better. So there are some reasons to be optimistic, but until we fix the flow through our departments, we're not going to make this any better.
Dr Adrian Boyle, thanks very much. Just a reminder, if you like what you hear, do give The Daily a follow. It should be pretty straightforward, no matter where you get your podcasts. We're back in a moment.
Donald Trump is heading back to the White House.
Together we can truly make America great again.
We are in for an unpredictable but fascinating 4 years.
And we're going to be following every twist and turn for the first 100 days. We'll be bringing you the latest updates and analysis first thing every morning. So join me, James Matthews.
Me, Martha Kelnick.
And me, Mark Stone.
For Trump 100 every weekday at 6 a.m, wherever you get your podcasts.
Time for some final thoughts from our health correspondent, Ashish Joshi. Ashish, building an NHS fit for the future is, of course, a stated ambition of this government. Did you see any evidence in the data today that they're advancing that cause?
If you look at the patient list, if that's coming down, yes, but that's the only real tangible way of knowing that the NHS is getting somewhere back towards where it used to be in terms of waiting lists. But the difference now is volume. When Labour were last in power, and the NHS was a really slick machine which ran well, efficiently, It's very different now. The population is different. There are complex comorbidities. People who present in their 50s, 60s, and 70s don't just present with one illness. They have complex medical needs. And then on top of all of this, you've got the fallout from the pandemic as well. So listen, they are making gains. The difficulty will be in making sure, while they focus on elective waiting lists, the other things don't slip, like the cancer waiting times and all the other things that hospitals are there for.
Drawing on your experience at the Royal Berkshire, I mean, the part of the problem remains the hospital estate, the places in which we are treating people.
Especially the Royal Berkshire. The Royal Berkshire is spread across a site which is some new buildings and mostly old buildings, which are still in use. And some of those old buildings are so dilapidated, they're ruined, that they've been fenced off. They can't be knocked down because it's a Victorian listed building. The Royal Berkshire was told it was part of the new hospital expansion programme. We had Wes Streeting, the health secretary, standing up in Parliament last week saying that was going to pause. So now the Royal Berkshire, which thought it was going to have this money, this capital expenditure to fix all its old buildings which aren't in use, which have been filled with concrete to keep them standing, but you can't use them. It's madness. They're literally a hospital which is running out of space and having to shut off parts of its estate because it's not fit for purpose, waiting for cash, which isn't coming until 2037. That's a long wait.
I mean, the government knows the state of the hospital estate, the NHS estate at the moment. You had Lord Darcy, the independent investigation into the NHS, discovering a £37 billion shortfall in capital spending.
Right.
I mean, if you don't have the money, you can't build the buildings. If you don't build the buildings, you can't put the beds in them. If you don't have the beds, you can't have the patients. It's simple.
Yep, it is simple. And we've had the boss of the NHS addressing that today, Amanda Pritchard, saying we have to look at PFI. We have to look at private money coming in for public expenditure.
Well, that worked out brilliantly under the last Labour government when it came to schools.
The health think tanks think this might be the way forward. They do their research, they do the number crunching. It's a way of generating that money. The money has to come from somewhere. You go to the Treasury, they'll say there's no money, no hospitals being built. The hospitals with existing problems can't have extra cash. What do? You will have to go to the private sector. And you are a political animal, so let me put it to you.
Go on.
Is it more palatable for a Labour government to suggest private investment in public expenditure?
OK, you asked the political animal to weigh in on this one. Well, I'll tell you this. PFI led to lots and lots of new schools being built, and the head teachers and the pupils who attended those schools were very, very happy to start with. It was further down the line when the private part of that PFI initiative came for their money. That's when we started to feel the cost, when we were spending hand over fist on properties that had already been built and were already being used, and seemingly for some of them, we're going to be paying in perpetuity for them. That was the issue.
Maybe then the financiers have learned that and can adapt a model for the NHS. I can't see where else that money would come from. It's got to come from somewhere. We can't have situations like the Royal Berkshire completely fencing off a large part of its estate and paying to keep it closed. It makes no sense.
Do you get the impression that this is a health service, and of course we're speaking very specifically about the NHS England today, that this is an organisation, an institution that is on the cusp of getting better, that they can see a way out of the tunnel?
Yes, because I think what's really important in all of this, and one thing we haven't touched on today, is they have, when I say they, the Labour government has the goodwill of the NHS workforce. And that is crucial. People are having to bend and flex and put in extra hours to bring those lists down, to treat those patients. And ultimately, it's going to be a long haul.
Ashish, thank you. To see more of his reporting and analysis, just head over to skynews.com. But before you do, why not give the Daily a follow so you ensure you get the podcast on your devices just as soon as it publishes. But that is your lot for today. We're back again tomorrow.
Donald Trump is heading back to the White House.
Together we can truly make America great again.
We are in for an unpredictable but fascinating 4 years.
And we're going to be following every twist and turn for the first 100 days. We'll be bringing you the latest updates and analysis first thing every morning. So join me, James Matthews.
Me, Martha Kalnick.
And me, Mark Stone.
For Trump 100 every weekday at 6 a.m, wherever you get your podcasts.